Rose October, breast cancer. Knowing myths and facts. With Breast Cancer Awareness Month just around the corner, Britain is gearing up for its annual explosion of pink-themed products, parties, activities, and events to raise money for breast cancer research and increase awareness of the disease. Over 50,000 women are diagnosed with breast cancer in the UK each year, and sadly around 12,000 women die from the disease each year, Dr. Lisa Wild, Director of Research at Breast Cancer Campaign, tells HuffPost UK. And it isn't just the cold hard statistics that breast cancer charities are urging us to understand. Breast cancer doesn't have just one cause. It is a complex disease resulting from interactions between our genes, lifestyle, and the environment. As well as established risk factors, there are often myths about potential risk factors circulating on the internet and in the media that are not supported by any scientific evidence. So it's really important that we get the correct information and evidence out there to counter these myths, says Dr. Wild. An even greater concern than the scaremongering myths are those surrounding the signs and symptoms of the disease, which can have far-reaching consequences. As well as knowing about risk factors, women need to be aware of the signs and symptoms, because the earlier a breast cancer is diagnosed, the better the chances of survival. We think every woman should be familiar with her breasts and report any changes to her GP. General practice. Some things to look out for, other than lumps, are changes in size. Ongoing pain, swelling, redness and rashes in both the breast and armpit areas, as well as changes to the nipples, discharge or inverted nipples. Annabelle Bentley, medical director at HuffPost, it's helpful for both women and men to understand that breast cancer can cause a range of changes in their breasts, not just a lump. So, it's important to get advice from a doctor if they notice a change in their breasts that isn't normal for them personally. We spoke to some of the country's leading breast cancer charities and medical experts to clarify the facts and debunk some of the most common myths surrounding the disease. See their responses in the following gallery. Myth: a healthy lifestyle plus no family history equals no risk of breast cancer. Breast cancer can sadly happen to anyone, at any age, says Dr. Lisa Wild, Director of Research at Breast Cancer Campaign. This is why it is vital that you stay breast aware, know what is normal for you and report any unusual changes to your GP. However, although lifestyle choices do not guarantee prevention, Carolyn Rogers, clinical nurse specialist at Breast Cancer Care, points out. Eating a well-balanced diet, taking regular exercise, maintaining a healthy weight and limiting alcohol intake can all contribute toward reducing the risk of developing breast cancer. Fact: motherhood can affect breast cancer risk. Evidence suggests that for every child you have, your risk of breast cancer is reduced by 7%, while every 12 months of breastfeeding reduces risk by 4%, says Dr. Wild. Sally Greenbrick, Senior Policy Officer at Breakthrough Breast Cancer, explains, in the long term, women who have had children are at lower risk of breast cancer than those who have not. With the more children a woman has, and the earlier she begins her family, the greater the increase in risk. However, she adds, research suggests the risk temporarily increases slightly, for a few years after giving birth, regardless of age. But it's important to remember that breast cancer in childbearing years is very rare. Myth: antiperspirant deodorants can cause breast cancer. Some people have argued the chemicals in antiperspirants, such as parabens and aluminium salts, have a link to breast cancer. But no scientific evidence backing up these claims has been found, says Dr. Wild. This is a common myth, which apparently started from a hoax email a few years ago, says Annabelle Bentley, medical director at BUPA. Research since then, looking at deodorants and breast cancer, has not found a proven link. At the moment there is no evidence to suggest that parabens cause breast cancer to develop. All that is known is that these chemicals are present in some breast cancers. Myth: breast implants can give you cancer. Breast implants are not thought to affect a woman's risk of developing breast cancer, says Dr. Wild. A recent study of over 3,000 Swedish women found no increased risk up to 37 years after having implants. However, breast implants can make it more difficult to see a cancer using mammography, so if you are going for breast cancer screening and have implants, you should let your screening team know so they can get the best image possible. The radiographer may wish to take additional X-ray images from different angles to be sure that all of your breast tissue is completely examined, adds Greenbrick. They may also want to check the images straight away to make sure they are suitable, which means your screening needs to take place at a unit with digital technology. Myth: having an abortion increases breast cancer risk. There is no evidence to support the notion that having a miscarriage or an abortion increases your risk of developing breast cancer, says Dr. Wild. An analysis published in 2004 of 53 studies including 83,000 women with breast cancer from 16 countries, concluded that a woman's risk of breast cancer is not increased by either having a miscarriage or an induced abortion. Myth: hair straightening sprays can cause breast cancer. Some hair straightening sprays have been considered as a possible cause for breast cancer, says Dr. Wild. Fortunately, a large study, which looked at African American women who had used straightening products 7 or more times a year, for 20 years or longer, found no increase in breast cancer risk due to use of hair relaxers. Fact: the higher your alcohol intake, the higher your breast cancer risk. Several major studies have confirmed that the more alcohol you drink, the higher your risk of breast cancer, says Dr. Wild. For example, a U.S. study involving over 100,000 women showed that women who drank 2 glasses of wine a day were 50% more likely to develop breast cancer than those who did not drink at all. Rogers advises, it's best to stick to the NHS guidelines, which state that women should drink no more than 14 units of alcohol per week, no more than 3 units in any day, and have at least 2 alcohol-free days a week. Myth: particular foods can cause or prevent breast cancer, there is no good evidence that any one particular food can effectively either cause or prevent breast cancer, says Wild. Bentley agrees. There is no single superfood that is proven to prevent breast cancer. However, another way to look at it is there are super diets, meaning that it is the combination of a range and variety of healthy foods which gives you the best chance of reducing your cancer risk. A healthy balanced diet is one which includes plenty of fresh fruit and vegetables, fiber starchy foods, lean proteins, and low-fat dairy products. Myth: wearing the wrong bra can give you breast cancer. Bra is an undergarment worn by women to provide support for the breasts. Wearing an underwired bra, or one that doesn't fit correctly, does not increase your risk of breast cancer, says Carolyn Rogers, clinical nurse specialist at Breast Cancer Care. But if your bra is too tight or too small, it can cause discomfort or pain. Download your guide to a well-fitting bra to find out how a bra should fit for comfort and support. Myth: breast cancer only affects women. Men can get breast cancer too. Though rare every year, around 350 men are diagnosed in the UK, compared to nearly 55,000 women, explains Rogers. Many people don't know that men can get breast cancer because they don't think of men as having breasts. In fact, both men and women have breast tissue, although men have much smaller amounts than women. Most men who get breast cancer are over 60, although younger men can be affected. We encourage men, like women, to be breast aware so they can spot and report unusual changes to their GP as soon as possible. Fact: certain birth control pills are linked to breast cancer risk. It has been established that women who take the combined contraceptive pill have a slightly increased risk of developing breast cancer, says Dr. Wild. But, the risk associated with the pill decreases when you stop taking it. Andre turns to normal after 10 years. She adds, it is important to note that 80% of breast cancers are diagnosed in women over 50. Age is a bigger risk factor, and since the contraceptive pill is largely taken by younger women, this risk factor contributes to very few extra cases of breast cancer. Greenberg also points out that the combined pill has changed over recent decades. Over the past 30 years, the levels of the female hormone estrogen in the combined pill have decreased. It is not yet clear whether the modern, low doses in the combined pill are associated with the same breast cancer risk as the older, higher dose pills. Myths: lumps are the only visible sign of breast cancer. A lump is just one of many symptoms of breast cancer, warns Dr. Wild. It is just as important to look out for any of the following signs: continuous pain in a breast or armpit, one breast becoming larger or lower, puckering or dimpling of skin, nipples becoming inverted, changing shape or position, nipples developing a rash, crusting or producing discharge, swelling under the armpits or around the collarbone. Check all parts of your breast, including your armpits and collarbone, adds Rogers. Breakthrough Breast Cancer Advocates TLC or touch, look, check. This simply means knowing what your breasts look and feel like normally, being on the lookout for any unusual changes and getting them checked out by your doctor, explains Greenwood. Myth: all breast lumps are cancerous. Thankfully, not all breast lumps are cancerous, says Wild. They may be benign cysts or overgrowth of tissue, but it is always important to report any changes to your GP, she adds. Fact: being overweight can cause breast cancer. Being overweight after the menopause increases your risk of breast cancer, and there is evidence to suggest that being overweight also reduces your chances of survival if you don't get breast cancer, says Wild. Fact: taller women have a higher risk of breast cancer. The taller you are, the slightly higher your risk of breast cancer, says Greenbrick. The reason why has yet to be scientifically proven, but Dr. Wild suggests that genes, nutrition, hormones, and amount of breast tissue may play a role. Knowing myths and facts. Rose October, breast cancer. Narrated, adapted by JoseSSAlmeida. October 1st, 2014. Text and photo, from web HuffPost UK. Music, YouTube Free Serve. Software, MS Movie Maker. Narrated by Bing.